The Youngevity UK and Europe Show with Dr. Wallach.
Hi, my name's Jonathan Smith. Welcome to the Youngevity UK and Europe Show with Dr. Wallach. Each week we'll go through the Dead Doctors Don't Lie show and handpick information regarding people's specific health concerns. So listen now as Dr. Wallach gives his expert advice on how to deal with the root cause of illness and disease nutritionally. If you would like further information on the products recommended in the show, they can be found in the description below the video. Enjoy the show.
The Youngevity UK and Europe Show.
I want to talk about a subject that affects everybody. Again, this affects everybody. We're talking about musculoskeletal stuff, osteoporosis, arthritis, fibromyalgia, tendinitis, degenerative disc disease, all this kind of stuff. Everybody goes through this if you don't supplement properly to prevent it. All of our tissues go away, the cells die, and you have to rebuild the cells. And if you don't have the raw materials to do that, you get symptoms, you get diseases, and they can be disastrous and even fatal if you don't have enough nutrition to maintain and rebuild these tissues, okay? So, I want to talk about, again, is musculoskeletal stuff issues, and osteoporosis is a big one. Let's just take osteoporosis, and I want to just focus in, and because I had so many calls when I talked about this about a month ago, people said, we need more information on it, osteoporosis of the skull. There's 25 different diseases you get from osteoporosis of the skull. The skull should be, under normal circumstances, about 1/8 of an inch thick. And when you have osteoporosis, I've seen skulls of people in their 80s and 90s, they're 1 inch thick, 8 times thicker than they should be. And, of course, what happens is the bone matrix material, kind of the rebar of the bone, fills up the tunnels that these 12 pairs of cranial nerves go through, 12 on each side of the head. They come out of the brain, go through the skull, come outside, and run through the muscles and under the skin and do things, okay? Well, they get squeezed because these tunnels get filled up with this bone matrix, okay? And, of course, degenerative disc disease, the discs lose their thickness. They get thinner as they lose the cell. You know, not giving your body the raw materials to rebuild them. So the vertebrae get closer together and begin to press nerves, okay, that control things. Very common one, of course, is sciatica, get burning and numbness in the feet as the lumbar vertebrae are close together, smashing the roots of the sciatic nerves coming out of the lumbar areas because the discs are shrinking. AFib is atrial fibrillation, where the disc between the first 4 thoracic vertebrae, T1, 2, 3, and 4, those discs shrink. Those vertebrae get closer together, and they smash the roots of the spinal nerves to control the rate and rhythm of the heart. Doctors will run up $500,000 worth of cardiac procedures when it's really a back problem. And they don't work. Cardiac procedures don't work because it's a back problem. Okay, now let's look at the degenerative diseases of the skull. Okay, cranial nerve number 1, it gets squeezed. The olfactory nerve, you lose your sense of smell. Very common. Cranial nerve number 2, it gets squeezed. It carries the light and the image to your brain, so you can actually see a picture from what the eye is collecting. It's called the optic nerve. It slowly squeezes, and people say, oh, I got degenerative disease in my optic nerve. Well, that's because it's being squeezed by that tunnel. And then number 3, the oculomotor nerve, is the muscles for the eye movement. The 4th cranial nerve, the trochlear nerve, more muscle from the eye movement. 5th cranial nerve, the trigeminal nerve, is a sensory nerve in your face and jaw. You get terrible bone pain, jaw pain. The French call it tic del roux. It's called trigeminal neuralgia. When it gets squeezed, as it comes through the tunnel that's being filled up with that connective tissue. The 6th cranial nerve, the abducens nerve, also controls eye movement and muscles. The 7th cranial nerve, the facial nerve, it gets squeezed, you get Bell's palsy, and the 7th cranial nerve can be involved in losing the sense of taste, as well as your face droops on one side, usually at a time, for that side, and initially people think they've had a stroke. The 8th cranial nerve is kind of interesting. It has 2 major branches. The auditory branch, when it gets squeezed, the 8th cranial nerve, the vestibular cochlear nerve, it's called, you get tinnitus, a ringing in the ears, and a gradual deafness. And then the vestibular branch, when it gets squeezed, you get an equilibrium problem. Okay, and this has historically been called Meniere's disease, or Wallach's vertigo. They named it after me. They figured out it was a nutritional deficiency and not just some genetic degenerative disease. The 9th cranial nerve, the glossopharyngeal nerve, controls your vocal cords, the tongue, the throat, and some of the muscles on the neck and the middle ear. And so you can lose your voice. Your voice changes, okay, and all kinds of stuff. Constant sore throat and everything. The ninth cranial nerve, glossopharyngeal nerve. The vagus nerve is very interesting. Controls your heart and your lungs, your stomach, and the diaphragm. There's a branch called the recurrent nerve. When it gets squeezed, you get the hiccups. When the main vagus nerve comes out of the skull, goes down into your stomach, you get what's called gastroparesis when it's being squeezed. Terrible stomach pain, maldigestion, everything. Doctors want to do surgery, and really it's osteoporosis of the skull, plus hiccups, that recurrent branch of the vagus nerve. The 11th cranial nerve, okay, is called the accessory nerve. Again, controls the muscles of the neck and upper back. And the 12th cranial nerve, the hypoglossal nerve, controls tongue movement and also some taste. So all of the various diseases that occur from the squeezing of all these 12 pairs of cranial nerves, doctors will do surgery. They will give you drugs. They will tell you had a virus. They will implant devices. They will all kinds of crazy stuff they do. Also dental stuff, of course. When you lose the bone in your face, your jaw, the holes that the bone, that the teeth are sitting in get bigger, so all your teeth fall out. You get receding gums. You lose bone mass. You look like you're 90 years old because your skull is getting smaller. Your skin just hangs on it. All because of osteoporosis of the skull. Healthy Bone and Joint Pack, MSM, vitamin D3, and Glucogel. Whoa, it all goes away.
The Youngevity UK and Europe Show with Dr. Wallach.
Thanks for listening to this week's show. If you're listening on YouTube, subscribe to the channel, and for more info on the products mentioned in this week's show, check out the links in the description.